Hello and welcome. Today, we're delving into a complex and often overlooked consequence of heart failure, cardiac cachexia. This condition, characterized by severe weight loss and muscle wasting, significantly impacts the quality of life and survival of individuals with chronic heart disease. Join us as we explore its causes, effects, and management strategies. Cardiac cachexia isn't simply about not eating enough. Its roots lie deep within the complex interactions triggered by chronic heart failure. The primary driver is believed to be persistent systemic inflammation. The failing heart struggles to pump blood effectively, leading to reduced oxygen delivery and nutrient supply to the body. This triggers the release of inflammatory cytokines like TNF-alpha, interleukin-6, and others. These cytokines, in turn, disrupt normal metabolic processes, accelerating muscle protein breakdown and suppressing appetite. Furthermore, impaired gut absorption and altered neurohormonal function contribute to the development of this debilitating condition. The pathophysiology of cardiac cachexia is a multi-faceted cascade. The inflammatory cytokines we mentioned earlier play a central role. They activate catabolic pathways like the ubiquitin-proteasome system, which breaks down muscle protein, and lipolysis, which breaks down fat. Simultaneously, these cytokines inhibit anabolic pathways, making it difficult to rebuild muscle mass. The heart failure itself contributes through decreased cardiac output, leading to tissue hypoperfusion and further inflammation. Impaired kidney function, often present in heart failure, can also contribute to fluid retention and further exacerbate the inflammatory state. This complex interplay of factors creates a vicious cycle that drives the progressive wasting away seen in cardiac cachexia. The prevalence of cardiac cachexia varies depending on the severity of heart failure, but it's estimated to affect between 10 and 40% of individuals with chronic heart failure. It tends to be more common in those with advanced heart failure, specifically those classified as NYH class citrate or AV. It's also observed more frequently in older adults and those with comorbidities such as chronic kidney disease or diabetes, further complicating the clinical picture. The signs and symptoms of cardiac cachexia go beyond simple weight loss. While unintentional weight loss, typically defined as more than 5% of body weight over 12 months, is a hallmark, other indicators include muscle weakness, fatigue, loss of appetite, and reduced exercise tolerance. Patients may also experience edema or swelling which can mask weight loss, making it difficult to assess the true extent of muscle wasting. Anemia is also common. The combination of these symptoms significantly impacts the individual's functional capacity and overall well-being. Diagnosing cardiac cachexia typically involves a comprehensive assessment that includes a thorough medical history, physical examination, and laboratory tests. Weight loss is carefully documented. Muscle mass can be estimated using methods like bioelectrical impedance analysis or more advanced techniques such as CT or MRI scans. Although these are not always readily available, blood tests can reveal elevated levels of inflammatory markers like CRP and TNF-alpha, and nutritional markers like albumin and proalbumin may be low. A diagnosis of cachexia is usually made based on a combination of weight loss, muscle wasting, and evidence of underlying disease or inflammation. While there aren't distinct types of cardiac cachexia, its severity can be classified based on the degree of weight loss and muscle wasting. Some classifications consider the presence and severity of inflammation and functional impairment. The key is to recognize that cachexia exists along a spectrum, from mild wasting to severe debilitation, and that early detection and intervention are crucial. Treatment and management of cardiac cachexia require a multi-pronged approach. There's no single magic bullet. Optimizing the treatment of the underlying heart failure is paramount, aiming to improve cardiac output and reduce inflammation. Nutritional support is essential. This often involves high-calorie, high-protein diets tailored to the individual's needs. Oral nutritional supplements can be helpful. Exercise, particularly resistance training, is crucial to help build muscle mass. Medications such as appetite stimulants or anabolic agents may be considered in some cases, but their use is often limited by potential side effects. A multidisciplinary team, including cardiologists, dietitians, and physical therapists, is essential for providing comprehensive care. Currently, there are no definitive prevention strategies for cardiac cachexia beyond aggressively managing the underlying heart failure and promoting a healthy lifestyle. This includes maintaining a balanced diet, engaging in regular exercise, and avoiding smoking. Early detection of weight loss muscle wasting is crucial, as earlier interventions are more likely to be effective. Educating patients and their families about the importance of nutrition and exercise is vital. The prognosis for individuals with cardiac cachexia is unfortunately poor. It's associated with increased morbidity, including higher rates of hospitalization and complications, and reduced survival. However, with early diagnosis and comprehensive management, it's possible to slow the progression of the disease and improve quality of life. Recent research is focusing on developing novel therapies that target the underlying inflammatory pathways and promote muscle protein synthesis. Some studies are exploring the potential of anti-inflammatory agents and myostatin inhibitors to combat muscle wasting. Further research is needed to identify effective strategies to prevent and treat this debilitating condition. Thank you for joining us in learning more about cardiac cachexia. Remember to consult with your healthcare provider for personalized medical advice.